Welcome, I'm Cynthia. We're going to discuss the theory of transformative learning. So, what is transformational learning? It's learning that occurs when our beliefs are changed or transformed, which changes our entire perspective about a topic, issue, or situation. During our time together, we will learn about the history of transformational learning and about two of its prominent theorists. We'll learn the key points of this theory and what place transformational learning has in medical education. Transformational learning is a politically based theory developed in the 1970s. It developed into four main avenues as listed below with their associated theorists. These avenues lead to the same destination of social action. This destination requires students to act on their newly formed knowledge, skills, and voice to change the current system. And now a bit about Pablo Freire. I feel he is the father of transformational learning, as the roots of this theory are traced to his book, Pedagogy of the Oppressed, written in 1968. Pablo Freire was born in Brazil in the 1920s and later experienced the 1930s Great Depression. He states he fell 4 grades behind in school because his poverty and hunger severely affected his ability to learn. He says, "I wasn't dumb or lacked interest. My social condition didn't allow me to have an education." These experiences shaped his concern for the poor and founded his educational viewpoint. Freire's work mainly concerned literacy and the desire to help people overcome their sense of powerlessness by acting on their own behalf. He believed that the oppressed could transform their situation in life by thinking critically about reality and then taking action. That education is a critical tool for liberation of oppression. It must give the learner the tools to be creators of their own reality. He also believed that the education system played a central role in maintaining oppression and that it had to be reformed in order for things to change for the oppressed. One of the many famous educational views of Freire is that education is always a political act. It is either an instrument of domination or liberation. It cannot be neutral. Jacques MEZIROW developed his theory of transformational learning in the late 1970s. Pablo Freire was a major influence in the initial stages of its development. MEZIROW based his theories on women returning to education after a long hiatus, especially one woman, his wife. He emphasizes perspective transformation as 10 phases of becoming critically aware of how and why our assumptions have come to constrain our perspectives, understanding, and feelings about our world. He believes that transformative learning is irreversible, and once completed, we have committed ourselves to action and cannot regress to levels of lesser understanding. Here is a schematic of MEZIROW's 10 phases of transformational theory. First, there is a disorienting dilemma, a catalyst or trigger event. One example would be a medical student in a palliative care rotation who must encounter death and dying for the first time. The next 3 phases, self-examination, critical assessment, and recognition, are where meaning takes place. Learners develop critical awareness of their current assumptions and perceptions, and then critically think, reflect, inquire, and discover new ways of thinking. Phase 5 is where we explore our options for new roles, relationships, and actions. In Phase 6, we plan a course of action, which occurs in Phase 7, which is the acquisition of knowledge and skills for implementing one's plan. Phase 8 and 9 are where we try out our new roles and build competence and self-confidence in our new roles and relationships. And finally, Phase 10, here we integrate our new perspectives into our lives. Here are some key points of transformational learning. It is a framework to understand how adults learn, grow, challenge, and engage themselves in transformative processes that are relevant for today. In transformative learning, educators will lead students to the edge of their thinking by challenging assumptions and help them develop inclusive and open perspectives. The ultimate aim of transformational learning is to prepare students in local, national, and global trends and emerging issues with competence in critical thinking skills to function effectively in our complex society. It's all about developing leadership qualities in our learners who will also possess sensitivity to life and people, have compassion for society, and develop an interdependent relationship with the world. A really nice example of how transformational learning impacts health science education is through international medical student exchange programs. A new location and culture allows exploration of our previous learning and more challenges to our current perspectives of medical care systems, treatment options, and gives us an opportunity to experience new or different medical environments and associated diseases. The importance of participation in classroom discussion, where there is freedom to offer personal opinions and experiences, participate in service learning activities in the local culture, helps to expand students' perspectives. Self-reflection and participation in-depth dialogue with local and other international students applies new insights to their learning, which may be applicable to their home country. Team-based class projects, faculty support, learning a new language are all important tools for transformative learning. Through international medical student exchange programs, health professionals in all countries can be educated to mobilize knowledge, engage in critical thinking, and ethical conduct so that they may become competent to participate in patient-centered, population-centered health systems as members of local and globally responsive connected teams. Through these experiences, students can encourage health education reform to bring about a student-centered, critical pedagogy and institutional transformation to address the social determinants of health and practices where health is negatively impacted. They can also be more involved directly by becoming involved in community development programs upon return to their home country. International medical student exchange programs allow health education programs to include not only student learning and competencies such as critical thinking skills, but also the ability to work in diverse settings, tackle complex issues, challenge social norms that oppress others, and view issues from multiple perspectives. Transformational learning in our health science education can allow for the following changes to occur for our students. Self-awareness, transforming from the novice medical student to a professional identity. Patient-centeredness, transforming from objectification to empowerment of the patient. Systems thinking, transforming from focusing on individual patients to understanding and utilizing the health system. Self-care, transforming from overwork to self-regulation and building resilience. I believe we have a lot of work to do in this area. Clinical skepticism, transforming from simplistic dichotomies to continuous critique. And understanding diversity from seeing people as the same to recognizing their uniqueness and individual differences. In conclusion, transformational learning is a framework to understand how adults learn, grow, challenge, and engage themselves in transformative processes that are relevant for today. Pablo FREIRE and Jack MEZIROW are theorists who have made major contributions to this theory, which has enabled the ability to change people's actions through a phased learning process of having experiences that cause us to challenge our perspectives to create a more open and enlightened, compassionate, and inclusive outlook. Medical education can greatly benefit from transformational learning to create providers who are better able to empower their patients, understand diversity in populations, use a critical eye to envision new and improved ways to provide health care to our world, and who are able to stand up and lead those changes forward. Transformational learning has the ability to change us and our world.